Tony Costello is Professor of Urology at the Royal Melbourne Hospital and also Director of the Prostate Cancer Research Centre. We're now at the 11th Prostate Cancer Symposium with over 700 delegates and some of the best urologists in the world. How did this meeting start?
The meeting started because I felt there was a need, Robin, to educate me and the rest of the urology community in Australia. We're not a very academic community.
Yep.
And 10 years ago I had 25 people come along to the Royal Melbourne, and I padded it with our nurses and our medical students, and we had one speaker and he gave 9 talks, and that was the start of it.
Wow.
And the rest is history, because now we have 700 delegates, we have 14 international speakers, and I think this week's been the highest class of academic information gathering you could possibly want. And I think we should be proud. This is a meeting that stands up internationally as good as anything I've ever been to.
I came to this fellowship because you're an international expert in robot-assisted radical prostatectomy. Now, you're the first person in Australia to perform the operation here. How did you start? Why the robot all those years ago?
Although I'm computer illiterate, I'm a tech head in some ways. I started laser surgery internationally in the early 90s for benign prostatic hyperplasia, and then one time in the US, late 1990s, I met the guys from a company called Intuitive Surgical, and they said, "We've got this robot, what's it do? It makes you see better and you can be more dexterous." And I said, "Oh yeah." And then I had a look at it. It was just so compelling to me. And I said to one of my colleagues, if you want to keep doing radical prostatectomy, you better learn how to do this. And then I had to convince the chief of the hospital to spend $3 million to buy one. That was probably the biggest hurdle to overcome. But I think since that time it's been a spectacularly successful program. I think we've trained something like 20 guys in robotic surgery here in Melbourne. We're now a centre that's internationally recognised. We've performed 1,400 cases of robotic prostatectomy. And people like you come, I think we send you back a better surgeon.
Absolutely, yes. That's the hope. You're also director of the Australian Prostate Cancer Research Centre. What's the remit? What's the purpose of this organisation?
The Australian Centre for Prostate Cancer Research came about from an initiative from Wayne Swan, who's the Federal Treasurer. In 2007, before the election, he spoke to me about doing something for prostate cancer research in a meaningful sense.
Yep.
He's a prostate cancer survivor. He had a radical prostatectomy at age 48, so he's pretty passionate about prostate cancer. And it's great to have a politician on your side. It's unusual.
Sure.
And prostate cancer has been a bit of a poor cousin compared with breast cancer. So he gave us $15 million, and we are using that for a 5-year program to develop dedicated prostate cancer research in 2 centres, one in Brisbane and one here in Melbourne in Richmond. Okay. And we have two arms to our program. We have a clinical program where we harvest the tissue, we take out prostate cancer tissue and have a bank. We freeze live the tissue and use that for our research. And we have a translational research program which is drug discovery. And at the moment we have 2 drugs we've discovered in our own lab, which we're bringing to clinical trial. So it's a good program, and we also have some softer science programs, information gathering, patterns of care, outcome research, those sorts of issues, which haven't been done for prostate cancer.
I know you believe that historically prostate cancer hasn't been managed as well as it could have been, and I've just been talking to Peter Scardino about the management of T3 prostate cancers. In your opinion, do you still think that we're undertreating these surgically and giving patients to have radiotherapy who may benefit from what we can offer?
I think that's a good question, Robin. I've had 2 issues with it. One, I think we shortchange men by not offering them surgery. I think surgery does better than radiation therapy in high-risk prostate cancer. That's my bias.
Yeah.
And sometimes we overstate these guys, that they don't have as aggressive or as significant a cancer, and we deny them the opportunity for a surgical cure. One of my concerns about radiation, I think it does a good job, but if you've got a high-risk prostate cancer, you get 3 years of hormonal therapy, and very few men recover their sort of masculinity after 3 years of castration. Yeah.
Sure, yeah. You're an incredibly busy man. Do you have any spare time, and what do you like to do when it's not prostate cancer you're dealing with?
I like to retire to the golf course and afterwards to the vineyard. So wine and golf are probably my 2 passions.
Wine and golf.
After my family, of course.
Of course. when I arrived here, I noticed there's a psychologist who's an intrinsic member of the department, which is peculiar for myself coming from the UK. Have you always had a psychologist with you?
When I took the job at Royal Melbourne, I asked for one thing, and I wanted to have a psychologist appended to the urology department, and it's a psychological oncologist or a psychologist who specialises in cancer.
Okay.
And the reason for that was I found we were getting very good at doing the surgery, but we weren't very good at the devastating consequences that surgery visits on these poor guys. We can cure their cancer, but we leave them wet and impotent with erectile dysfunction, and it's a devastating problem, and it can tear marriages apart or relationships apart. So every patient that comes to Royal Melbourne gets to see our psychologist before they can help them make the decision about what treatment they're going to have, and then deal with the cancer diagnosis and also deal with the side effects. And it's been a very successful program.